Thank you. We'll now have primary opposition come forward. You'll collectively have 10 minutes.
Thank you, Madam Chair and members. Nick Louizos with the California Association of Health Plans. CAP represents 40-plus state-licensed health plans in the state of California, delivering high-quality and coordinated care to approximately 27 million Californians. Our members operate in all markets, individual, employer, and public programs like Medi-Cal. CAP also supported the Managed Care Organization tax last year, which is a tax on our members and our consumers, more specifically your constituents, to invest more money in the Medi-Cal program to improve rates for providers and improve the delivery system. CAP is part of a coalition that is strongly opposed to AB 2200. Our coalition consists of doctors, hospitals, employers, and others that are strongly opposed to this bill because it is too costly, eliminates choice, thrashes our existing delivery system, and ignores the hard work that we have done in California and the hard work that we are still doing. Overall, members, it makes zero sense to replace our current healthcare system with a costly, untested new system that would hurt patient care, especially when we're making strides on affordability and are so close to achieving universal coverage in the state of California. Thanks to actions by this governor and the state legislature, California is closer than ever to achieving universal health care for all. Since Covered California's first open enrollment period in 2013, Californians' uninsured rate has fallen from 17.2% to just 6.5%. Nearly 1.8 million people enrolled in Covered California plans during the most recent open enrollment period. That is a record number of health insurance signups in the state. With new policies beginning in 2024, virtually all Californians will have access to health coverage. And we continue to make strides in making healthcare more affordable for low and middle income Californians. New subsidies provided under the American Rescue Plan have significantly improved access to affordable healthcare for all. Covered California is also in the process of implementing cost-sharing reduction subsidies for people at Covered California. Currently, 2/3 of Covered California's customers are eligible for comprehensive coverage at a cost of less than $10 per month. Additionally, the Office of Healthcare Affordability is on the verge of setting a statewide spending target in healthcare that will encompass virtually all sectors. CAP supports a workable multi-year spending target as well as the overall mission of the Office of Healthcare Affordability. Members, one thing that you hear from the supporters of this bill is that Californians are opposed to or believe that we should completely change over our existing healthcare system. And we have found that Californians are satisfied with their health care that they receive for themselves and their families today, and actually want to build on the progress that we've made under the Affordable Care Act and not start over with the new healthcare system. And yet today we're considering a massive, costly, and untested system that would destroy the progress that we've made thus far. A recent LAO, Legislative Analyst's Office analysis of this bill, or single payer, I should say, not the specific bill, single payer legislation in the past pegged the annual cost of single payer at roughly $500 billion annually. That is more than twice the typical state budget. And we don't have a funding plan associated with this bill, and we'll hear more about that later. Almost half of the funding, roughly $200 billion annually, would require a waiver from the federal government in the form of congressional action. Even if granted, this could be revoked by a later Congress, leaving California's single-payer system, if it is enacted, with a massive budgetary shortfall. The other half of the funding, around $250 billion, would be paid for by taxpayers in the form of higher taxes on jobs, income services, and more. If the congressional waiver does not happen or gets revoked, the taxes would need to be doubled, roughly. Californians, by and large, oppose the tax increases that would be necessary for a single-payer system. And access to quality health care. If one of the other things, that you hear from the supporters of this bill is that other countries have enacted some sort of single-payer paradise in other countries. But if you really look at the evidence, access to quality health care has suffered tremendously in other single-payer systems. According to some studies, the median wait time in Canada a country with a single-payer system. Between a referral for a general practitioner to a specialist procedure is 27.7 weeks. That's in contrast to the wait time in the United States, which is under 30 days, about 26 days. Also, Britain's National Healthcare Service is in crisis as it deals with the lack of facilities and equipment, cost increases, and an exodus of healthcare providers in that system. Indeed, some providers that are just starting out in the British healthcare system are paid less than baristas and fast food workers in that country. And so I don't know how you would be able to sustain a workforce necessary to keep the system going. Members, as you know, California is facing a massive budget deficit. Our priority should be safeguarding the existing programs and services that we have in place now, not passing legislation for a $500 billion healthcare system that has never been tested. Single payer would force all 39 million Californians out of their existing coverage, including Medicare, employer-based coverage and covered California plans into an untested system with no ability to opt out. Californians oppose single payer that offers no ability to opt out or to choose private coverage. They oppose a single payer system that eliminates Medicare as an option for seniors. Californians want the right to choose private coverage. Instead, single payer will eliminate patients' choice of coverage and could endanger their choice of physicians, hospitals, and other providers. California would lose doctors to other states, leading to longer wait times and reduced access to care. And then, members, I'll close with this. SB 770 was legislation that was passed last year, and that is initiating a process to explore the necessary federal waivers for a single-payer system. Passing full legislation is not only premature but highly questionable at this time for this and for budgetary reasons. And until whether we know a waiver is even possible for the state of California, we shouldn't be considering this bill. So, I think that's a good place for me to stop, and I'll pass it over to Preston from Cal Chamber. Thank you. We're opposed to this bill, and we urge you to vote no.